Welcome back to the last session of the Global Health Talk. We will deal with a topic that has been touched upon already in the previous sessions, pandemic preparedness and response, and also the G7 presidency. The Global Health Hub Germany has been trying to provide information on the health-related priorities of the different ministries in the German G7 presidency and also of the G7 engagement groups to make this many information more easy to digest and available. And but now the ministerial meetings have taken place, the G7 engagement group summits have taken place, the leaders summit has taken place, all the communiques have been released. Now it's time to appraise what has been agreed upon and also discuss the way forward. And I'm glad to have this panel here today with us, and Anja Langenbucher as Director for the European Office of the Bill and Melinda Gates Foundation to guide us through the next panel discussion. Anja leads the Foundation Policy, Advocacy and Government Relations activities in Europe, and I'm honored to have you here. The floor is yours, Anja.
Thank you very much. Thanks for the kind introduction, and thank you very much both for the Global Health Hub to host the Global Health Talk 2020 to this important topic of pandemic preparedness and response under the German G7 presidency. And thank you very much for the panel, both physically and virtually, to be here today, which is great. You already introduced myself. Thank you very much. With regards to what we want to discuss today as part of the panel, we've seen that the German G7 presidency has really continued the work that was kicked off under the UK presidency with really putting global health and pandemic preparedness and response specifically into the center of the agenda, which was great from our perspective to see. And now that we have the G7 health ministers communique and the overall leaders communique, it's really good to see that pandemic preparedness and response is at the center and has quite some few deliverables that have been articulated and been part of the communique spelled out. So maybe this is the right time and a good moment to actually take stock and have a look how these deliverables are doing and how successfully we may be actually on our way to see them actually implemented from the perspective of the different engagement groups on the one hand side, but also from important stakeholders like yourselves that are in a great position to actually assess that. Secondly, it'll be great to look a little bit ahead to the G20 under the Indonesian presidency and explore where are important follow-ups, where are synergies, and where can we see some of these important deliverables actually be taken up. And then in a third part, finally, we'd like to also look ahead even more to the end of this year. What is left for the German G7 presidency to do, and then looking ahead to the Japanese presidency next year. So with that, I'm sure we have a rich program and a lot to talk about with this panel. And first of all, again, thank you very much for being here, both on the screens and here on the chairs with us. So it's excellent. I'd like to introduce all of you first. Welcome, Dr. Tania Rödiger-Vorwerk, Deputy Director General of the Directorate Global Health, Resilience, Equality of Opportunity at the Federal Ministry of Economic Cooperation and Development. Thank you very much for being here. Christophe Bähr is the head of the Division on Health Security and International Crisis Management at the Federal Ministry of Health. Thank you very much. Important. And here in the room with us as well is Angela Bähr, which representing the engagement group Civil Society Group 7. And Angela Bähr is the Director of Projects and Programs at Deutsche Stiftung Weltbevölkerung, but of course a very accomplished development expert over the years. She's also the Deputy Chair of VENRO, which is the German civil society umbrella organization. And then on the screens online, we have Ms. Fumie Saito, who is representing the W7, where she's acted as and served as an advisor for the Women 7. She's the Director of Global Advocacy of the Japanese Organization for International Cooperation and Family Planning. and is a very well and renowned expert in public policy in the field of gender equality and SRHR. And then finally, I'd like to welcome Dr. Gitahi, who's representing the T7 today, the Think 7 for us, a long-standing experience in global health. He's currently the chief executive of Amref Health Africa, but also served on many boards, and that includes the African CDC, the WHO, and CEPI. And so I think this is really an extraordinary panel, very distinguished, and will bring us a lot of interesting perspectives to this discussion. We'll go through basically 3 parts in our panel, where I will go to all of you to help us assess what I was laying out at the beginning. And in the end, we'll also have the opportunity to bring the audience into the discussion, which I'm looking forward to, both with online questions that will come here via the Slido tool, but also please feel free to ask questions directly, which would be most welcome. So with that, I want to dive right into the first question, which is really assessing a little bit where we are with the deliverables on the G7. We've seen the communiques, we've seen that the Pact for Pandemic Readiness has been like a cornerstone, and I've been printing it out one more time to read it before the panel, just to make sure we're truthfully reflecting it. It is aiming at aligning many different initiatives, and so that's of course a very ambitious endeavor, because as we know, we have a fragmented global health landscape, and I think that's one of the challenges also, which has opportunities and challenges both to it. And so I was wondering, Christophe, Bähr, if you could give us an assessment. How do you think this pact fits in? It's been, of course, announced with quite a lot of ambition. We also have a treaty on pandemic preparedness. We have other WHO obligations, and the pact has a bit maybe, the downside of not being legally binding. So how are we doing, and how do you see the pact being actually a tool to help us overcome the fragmentation and rather really align the initiatives and not be in competition or another, kind of another thing that we need to make sure, it gets implemented. So I would love to hear your view on this.
Yeah, first of all, thank you very much for the invitation. I'm very glad and feel honored that I have the possibility, the opportunity today to give you some further insight in what we are currently doing within our G7 presidency. Therefore, thank you very much for this. Regarding your question, so first of all, I think you mentioned already a couple of key points on the Pact for Pandemic Readiness, which we are having here. So first of all, it should not be really a new initiative regarding what you said about fragmentation. It should not be a new institution or not be a new entity. It should build on existing initiatives, and it should bring the G7 together to work concentrated and in a strong manner on 2 main deliverables, which we are talking about here. For example, which is the deliverable on collaborative surveillance, strengthening surveillance systems. There are many more things, and I can continue for a long time talking about then surveillance and what in particular is important about it. And then in particular, when it comes to predictable rapid response, and in particular regarding workforce. We wanted to invest in people, we wanted to strengthen expert workforce, we wanted to ensure that there are more trained experts working on surveillance issues, and at the same time being ready then to respond in a predictable way. We wanted as well to foster a network approach, and we already have made the experience that within the G7 there are quite a number of initiatives. And at the G7 presidency, our mandate is to the G7, not beyond. And therefore, we wanted to start with aligning our G7 actions and try to foster synergies here as well. If you allow, I just wanted to draw on some further points. So within the G7 Pact for Pandemic Readiness, there are also, or within the framework, there are also some commitments, and we are very happy that one of the commitments now came already into the Leaders Declaration, and this commitment is on the strengthening of IHR core capacities, and IHR core capacities are very much based on the surveillance systems, knowledge of expert workforce, and so on, which is the commitment of the G7 to continue for the next 5 years to support at least 100 countries implementing the IHR workforce, and we wanted to focus and concentrate and align on workforce development, surveillance, and response capacities. You were as well mentioning what the way ahead then with the G7 Pact for Pandemic Readiness. So what are we going to do and how might it be monitored? And therefore I just wanted to underline that during the next half of the year, we wanted to have 2 meetings with the G7 partners, 2 technical meetings to bring the concrete ideas and action forward, one on collaborative surveillance, one more focusing on workforce building for rapid response operation. And then there will be as well a sort of a results-based paper or paper which is summarizing the results of these meetings we are having. And of course, you might ask, okay, then you have the presidency in 2022, what's happening then? And there I just wanted to mention 3 points. The first point is that, of course, we are having these follow-up meetings. There's something happening during the second half of the year. Then the Pact, as a second point, the Pact for Pandemic Readiness is part of the Leaders' Declaration. That is meaning we have to follow up within the regular process of the accountability reporting. This is fostering accountability as well. And I just wanted to draw your attention. There is one sentence which came in, which is saying more or less in the Leaders' Declaration, we will step up, align and track our efforts on pandemic preparedness in close collaboration with WHO. So the leaders committed to step up, align and of course to track these efforts, and we are currently discussing how best to ensure this. And I think this is, I very much personally welcome this. This is an additional layer when it comes to monitoring what we are doing.
Thank you very much. That sounds very encouraging. That it actually, and I agree with you, the fact that it's in the Leaders' Declaration is, of course, a great step forward. Dr. Rödiger-Vorwerk, from the BMZ perspective, equitable access to vaccines and sort of the scaling up of local manufacturing capacity was always something that from the beginning of the COVID crisis was really at the heart of something that the BMZ has been pushing and was really important. So from your perspective, which deliverables do you believe have been agreed that help you or that would be helpful in bringing this forward?
Yes, thank you so much, and I really appreciate to be together here again with you on this distinguished panel. So what my colleague Christophe Bähr just said was very insightful, and I would say congratulations, because what is on the headline of the summit in Elmau last week, that the G7 came together and discussed urgent global priorities, and I think the most important is that safeguarding and advancing global health remains on the high priority agenda within the G7. This is, I would say, this is the headline. This is very important. So, what did the G7 discuss? So they remain committed, firstly, to end COVID-19 pandemic and enhancing the preparation for possible future pandemics. And let me highlight 2 priorities of the G7 heads of states agreed on. So firstly, the first is ensuring equitable and sustainable access to safe, effective and quality ensured and affordable vaccines, therapeutics and diagnostics. So the access to COVID-19 tools accelerator, the Act A, was confirmed as the most important tool to coordinate and accelerate towards this goal, and the G7 have made significant financial contributions to support the Act A. It's a number of 18.3 billion. This is quite something. So as a next step, it will be key to evaluate the lessons learned from the Act A and shape the transition towards a refocused structure and pandemic preparedness and prevention. So the heads of states underlined their support to partner countries in building sustainable local and regional pharmaceutical productivity capacity And the goal is to ensure equitable and sustainable access, which contributes to overall strengthening health system. So what does this require? This requires, on the one hand, investment in capacity building, technology and infrastructure. So regarding the latter, G7 development ministers tasked Gavi to elaborate a market-shaping strategy jointly together with other relevant stakeholders like the Global Fund. So this was the first basket. The second is accelerating pandemic prevention and preparedness. So the G7 heads of states agreed to shape the transformation from the acute pandemic response to preparedness and prevention. And I think this is very important because we come to a sustainable future system, a systemic change. So they announced their support for setting up the Financial Intermediary Fund, the fifth, for pandemic prevention and preparedness and response, which we, together, last week with others, established at the World Bank. So finally, it's a major step. And we start now elaborating how the governance structure will be and how this will work out with the other actors in the global health system. And the G7 heads of state underlined the need to work in partnership for equal access to affordable, quality-assured and reachable health care systems globally. And I think this is very important, to work in partnership. They reaffirmed strengthening health systems to achieve progress towards a universal health coverage as priority, aligning it to pandemic prevention, preparedness, and response. And stepping up, and this is my last sentence, stepping up efforts under the One Health approach and investing in health system performance. I think this is crucial for prevention, and I think this is a major step in a common approach.
Thank you very much. I think that's it's very good to call out the ACT Day again as a really key cornerstone of what was achieved, and I agree very much with that. Let me turn to our online virtual participants now. Dr. Gitahi, we already mentioned the international health regulations, which are obviously a core element in order to address and enhance the pandemic preparedness. And there was a G7, as you were mentioning, a G7 commitment to support 100, I believe, low and middle income countries, and to support the implementation of the IHR. What do you, from your perspective, think of that commitment, and what, in your view, is really needed to make sure that that is seen through and followed through? Dr. Gitahi, could you?
Thank you very much.
Yes.
And let me first appreciate the centrality of, yes, let me first appreciate the centrality that the G7 gave to health in their discussions, which is unusual. I think health has always come second to social, political, and economic development. But now we saw this paid attention to, including in the community. So I think those of us in the sector need to appreciate that. Directly to the question on the international health regulations, we all know that the international health regulations is a framework of attempting to keep the world safe. And that would only happen if every community is safe. We know that pandemics start as outbreaks, and they start in a single community across the globe. And they end in a single community across the globe. So the first thing to say about the IHR commitment is that they appreciated, of course, the 100 countries need support, because we know that many countries that are low income have been unable to develop their core capacities for implementation of IHR. The first thing I want to say about the G7 commitment, as much as it's appreciated, is that it's going to be as good as its implementation. A few examples in the recent past: the commitments to provide COVID-19 vaccines to low-income countries have not even reached 49% of the commitment itself. So the G7 members are way behind on their own commitment, which is not a good example of what to expect on the support for the 100 countries on IHR. Secondly, we know that the GNI, the gross national income commitment on 0.7% for the high-income countries has also not been achieved. And I think even as we look at this and celebrate it, we need to look at what are the reasons for the non-achievement. And I didn't see much reflection at the G7 about reviewing why commitments have been made have not been achieved. But what do the low-income countries need for the achievement of IHR? As I said earlier, pandemic started outbreak in a community. We know, reviewing the data of WHO, assessing the core capacities of countries using the 8 core capacity framework, we know that certain areas have always been weak. And those areas include, for example, financing. Secondly, human resources for health. And third is public health capacity. These are the areas that the G7 needs to look into. And most importantly, flexible, agile financing. I was part of the National Task Force in Kenya. I was part of the Africa CDC framework for response to COVID-19. And one thing I noticed is that flexible financing is at the center of pandemic response. I saw governments struggle to even quarantine people because they didn't have flexible financing, because the public financial management infrastructure, which was set up by IMF during the debt forgiveness in the 80s, does not allow governments to have any flexibility on their budgets. There's an area that needs to be looked at, and I'm not sure whether the FIF implementation framework will actually pay attention to flexible and agile financing for disease surveillance and response, because we saw the Pandemic Emergency Response Fund of World Bank several years ago fail and could not be triggered in the midst of an emergency. I hope the learnings from that will be brought forward to the FIF to ensure that the support of IHR in providing flexible financing for response is actually addressed. The next area is human resources for health, and also, as has been reflected earlier by the someone who spoke earlier, and also coordination of public health activities across multiple countries through hub and spoke models, developing national public health institutes, and all that requires public health, human resources for health. Finally, support regional and local and national infrastructure, like Africa CDC, the Africa Pandemic Preparedness Authority. This needs to be supported, because the more proximal you are, the more successful you're going to be in implementation of IHR.
Thank you very much. I think that was very clear, and some very clear demands and requests what we need. Let me turn to our next online speaker, Ms. Saito. You've been advising the W7 from a gender perspective, and I think we all have heard often that we do need strong gender equality focus on this economic recovery that's now coming post-COVID, so to say. How do you feel these demands of the WF7 have been reflected in the leader statement, in the summit, and in the deliverables that we're now seeing? And are you satisfied with it?
Thank you. Hi, I was in Berlin and attending W7 a few weeks ago. And then at that time, we submit the W7 recommendation to the Chancellor. And then I would say our recommendations are well taken. So we are kind of welcome on G7's commitment advancing gender equality, and also the inclusion of gender perspective in all policy areas. But of course, we like to see more concrete funding and concrete financial commitment and measurable goals. But in that sense, so we also welcome that G7 set up a gender dashboard as a monitoring tools, and which is managed by OECD. But because of OECD, well, when we look at the indicator, well, especially under the health section, we only have 2 indicators. One is prevalence of physical and sexual violence against women and girls, and also another one is maternal mortality. I would like to see more other indicators in health section, and for example, prevalence of comprehensive sexuality education, or access to safe abortion, or women's leadership in the health sector, which will be the next round, I believe. And speaking of healthcare in the G7 community, I'd like to highlight 2 aspects. One is a healthcare workforce, and then second point is SRHR, sexual and reproductive health and rights. About the healthcare workforce, 70% of healthcare workforce were women. So that means those women are also double binded by uncared health work and unpaid care work. And for tackling this point, actually G7 made a financial commitment to child care infrastructure initiative. It's called Child Care Incentive Fund run by World Bank. I hope to see, but so the unpaid care is actually, you have to tackle social and gender norms. So I hope, this child care incentive fund will be tackled to this point too. And speaking of actually funding, about SRHR, we don't have any funding commitment from G7. And then that part is actually the funding is reduced because of the pandemics. So we need concrete funding commitment to SRHR, not only for international organizations, but to the local clinics or even to the advocacy work. So that's all from Nana. Over to you.
Thank you. Thank you very much. Drawing our attention to what we're missing and where we are still lacking commitments such as SRHR and calling out the care fund. I think that's, thank you very much for that. Angela Bähr, turning to you now to maybe reflect a little bit on the policy recommendation that civil society has given. I know there was, of course, also the access to health commodities being one of the key issues that were discussed. So would love to hear your assessment on the G7 deliverables.
First of all, thank you very much for being here this afternoon, and I'm really delighted to take part in this panel. VENRO was the ones who organized the C7, or the C7 response, in a really overall international discussion, I would like to say. And let me come back to the production capacities. Oh no, sorry. First of all, I would like to say that the C7 is still in process of evaluating, let me say, the framework and the results. And afterwards, for sure, we are giving over to the C7 delegation in Japan, and then will be really a strong commitment to see how to follow up also the results of the G7. But for sure, the production capacities in low and middle income countries have to be or needs to be expanded. I think that it's quite sure. And the global vaccination rate so far it's not being sufficient. That is also very clear. Let me give only one example. According to the WHO, in Madagascar, for example, 8.6 vaccine doses have been allocated per 100 inhabitants. In Germany, the number is 217. Only to say that, for sure, some of you will say now, okay, but the the situation in Africa is different also, and lots of people would not like to get the vaccine. There's the demand side, it's not so strong there. But on the other side, how the demand side would be strong if they are not getting informations. So let me say, please, here, the health prevalence is quite important here. We know that there is a lot of misinformation in place, especially, and here I'm coming back to my colleague from the Gender 7 for sure, especially when we are talking about young women and possibly repercussions of vaccines, for example. And what we don't know at the moment is what will happen if there is another new outbreak. So perhaps at this moment, the need is not so big, that could be. But let's have a look in the future. So we obviously have a staggering worldwide vaccine inequity. And I would like us to be honest also, because in the Leaders' Declaration it said, the G7 referred to over 1 billion vaccine doses that have donated since last summit. And we have heard here, all in the room, the former panelist from the Kofi Annan Foundation. He brought into the discussion here all the pros and cons regarding the TRIPS waiver. And let me come to this, because this has been one of our, from the C7 communique, one of our most important demands and asks to the G7 was the support of the TRIPS waiver for COVID-19 health commodities. The compromise of the WTO members recently agreed is far away from being satisfying, to be honest. After 2 years of negotiations, it has not been possible really to come along with a solution, but what makes possible the access and the equitable access to therapeutics and diagnostics and vaccines means we are not talking only on vaccines. We are also talking on other health commodities here. And only the equitable access in really urgent situations, like a new outbreak, for example, that would really guarantee the common global health as a common global good and as a human right. And as C7, we are really thinking about how to reach more recognition of this health situation at all, also from the G7. And let me say a last word regarding the Act now, the A-Act, sorry. It is, I heard here, it is really a successful instrument, but there was a big gap. The gap was that the participation of the civil society, and especially of the low and middle income countries, was quite zero. So I really hope that in the common instruments and in the common discussions for the Pact for Pandemic Readiness, civil society, but also the least and middle income countries will be included. Thank you very much.
Thank you very much for this important call out, both on the access but also on the inclusion for LMICs in this discussion. I think this was a very good first round, and I think we've heard a lot what on the one hand side, you feel is reflected in the G7 deliverables, but not yet quite there, which is, I suppose, exactly how one should usually feel after a summit. Let me now turn to the second block of questions that we wanted to discuss, which is really around, on the one hand side, the global health architecture at large, but then also the possibilities on how the upcoming G20 under the Indonesian presidency can maybe pick up some of the questions and follow them through, and where we can explore synergies, given that for the G20 we have a much larger group of relevant countries at the table. If I may start with you again, Dr. Bähr, we already had the fifth thrown, the Financial Intermediary Fund, into the discussion. You mentioned it, you were both negotiating it. It's been something that's out in a discussion for a while now, and of course the question is, how can we ensure that the governance structure is in place which ensures actually additional funding, which helps with limiting the fragmentation and actually moving on to a more comprehensive funding picture, and maybe does not compete or cannibalize even existing funding sources. So how do you assess the progress being made so far, and what do you think we need to bear in mind as we're operationalizing the fifth?
Yeah, thank you very much. I think already my colleague Tania Rödiger-Vorwerk mentioned the fifth and gave us some first thoughts on it. Just wanted to underline that first, we are all happy that the establishment of the fifth is decided right now, and Financial Intermediary Fund, which is focusing in particular on future outbreaks and pandemic preparedness and response in particular. Chancellor Scholz, just to underline this, he committed 50 million euro, additional 50 million euro for it. And as I already said last Thursday, the World Bank board has agreed on the establishment then as well formally of the fifth. There's a hard way ahead during the next months, as you already said, and now there will be the as well technical discussions on key documents to be agreed on. And the aim is still to have the fifth up and running by fall. And as said, I mean, it will be quite an important, and it will be as well a difficult task to agree on all the details. But let me just summarize it, that here in Germany we have a whole of government approach. There are a lot of discussions ongoing between the different ministries on how in principle this, or in more detail, this fifth should look like. And there are as well all the other countries. And we need to keep in mind it's more or less a consensus approach. The countries who are the donors need to agree on a consensus. And just wanted to underline, we have 4 main principles here in Germany, which are very important for us. So it should be a new instrument, which is not cannibalizing other which is not cannibalizing other instruments and funds. And this is quite in the current fiscal situation and what we see on the horizon. It's a challenge, I have to admit. And it should have a clear mandate and clear focus, which goes without saying. And this clear mandate and focus should be on pandemic preparedness and response. And in our view, it should be as well, taking up what you have already said, it should focus on the collaborative surveillance and as well on workforce development, on the human resource side for this. And then we have another third principle, which is we want to see the expertise of WHO, and there are different models which are currently discussed on how this might be implemented, but for us it's important to have the expertise of WHO in. And then as a fourth and last point, it's an inclusive government which includes as well donors, recipients, civil society, might as well have some room for the private sector as well to have then an inclusive government. So hard weeks ahead, but I stop here.
Sounds complex, but hopefully still with a very good, and as you say, of course, a collaborative and inclusive consensus is usually, of course, more sustainable than anything else. So hopefully the hopes in the fifth are all justified. Angela, Bähr, let me turn to you on the next question, because the as I said, global health architecture is going to be a core element of the G20 agenda, and of course the issues that are close to your heart, and what of course the also VENRO is standing for, the major disparities, unequal distribution, and of course the access, as you were saying, to vaccines, but also other medical tools, diagnostic therapeutics, and equipment. Where do you see the opportunity of the G20? And again, maybe also bearing in mind who's at the table this time around. Currently, we have a big discussion who's actually attending. But what is the opportunity that you hope, with this different and larger set of actors, which certainly makes it more complicated, but maybe also more rewarding in terms of outcomes?
Thank you again. First, I would like to say that we welcome the G7 support for all 4 pillars you said about of the access to COVID-19's tools accelerator. But there are also lots of more diseases we should not forget. In this context, is an important outcome that the G7 supports the funding of Global Fund for AIDS, tuberculosis and malaria. And here still, what is still missing is a clear number. I think everybody here in the room knows that how much the G7 will pledge to achieve the $18 billion, which are at least needed for the Global Fund. And without continued funding to end an HIV/AIDS, tuberculosis and malaria by 2030 as a major contribution to meeting the Sustainable Development Goals will not be achieved. This should be a very important discussion also at G20. Positive is also the promised funding of the Global Financing Facility for Women, Children and Adolescents, as well as the Global Polio Eradication Initiative. That means we need, and everybody needs to have health at a broader focus. Yes, pandemic preparedness is very important, but let's not forget other health issues, especially the ones I have mentioned here. And we need urgently gender transformative approaches in all global health initiatives. Because, and here I would like to support my colleague really again, because we have a silent epidemic. It's a really silent epidemic, at least in the sub-Saharan Africa. Teenage pregnancies and HIV/AIDS new infections for young girls. Only really to have it in mind. I think it's quite important to really have concrete measures. What does it mean to have gender-sensitive approaches and really to target the most vulnerable ones here? And we definitely welcome the support for strengthening the budget of the WHO. To prevent fragmentation and to reinforce global solidarity, it is very important to strengthen WHO's independence and coordinating role. And we sincerely hope that G7 and G20 will increase their contributions at the next World Health Assembly. These are the positive outcomes of the G7 Leaders Declaration, and we hope that it sends positive signals to the G20, and that they are really able to discuss also the urgent issues in health, because we know that under the G20, there are some of the middle-income countries who can really strengthen their production of medical treatments, for example, and that there will be open discussions how it could be, and perhaps a TRIPS waiver or something like an instrument could be discussed there also. So thank you very much. And at least, please don't forget universal health coverage, because only if the whole system, the health system will work, then a pandemic preparedness could function also. Thank you.
Thank you. Very important points, obviously. Dr. Gitahi, you've been a part of the T7 task force, and with regards to looking ahead to the Indonesian presidency and the global health architecture question, what were the key recommendations of the T7, and are you satisfied with what has been agreed, or other issues that you still hope are being addressed in this broader round coming in the fall?
Well, thank you. Thank you very much. I hope the audience can review the paper. It's quite elaborate, so it might not be appropriate to review all of it here. But I will just highlight some of the key things that we asked for. We asked for, first, a change in the way the G7 approaches global health. We asked for a system that incorporates values, transformation, and investments. And some of the key areas that we thought were important, and some of them have been picked up, so I'll probably just highlight the ones that we think could have been done better. One is on the global health infrastructure. We are glad that the G7 reiterated its support to a well-financed, supported WHO, reiterated its support to the financing of Global Fund, and also supporting the FIF, which, as I said earlier, we are watching closely what the implementation mechanism is going to be, because that's what will determine its usefulness. If we don't agree on an inclusive governance, inclusive, responsive framework for the implementation of the FIF, not only for when pandemics arise, but even for pandemic preparedness, then the FIF itself would have been dead before it starts, as we saw in the past. But I'm hoping, listening to colleagues here, that is actually a priority to ensure the implementation framework works. I was a bit disappointed I didn't see much on the CEPI, on the support for research and development, especially on the existing Coalition for Epidemic Preparedness Initiative, CEPI. That can be discussed elsewhere. But the key points that we put in the paper that I think should have been picked up is the issue of start-stop. We had asked for a G7 Global Health Compact that actually looks at 7 years up to 2030. The challenge we are having with sustainability and continuity is that every G7 presidency comes on with its own promises and its own priorities. We had asked in the paper for a G7 Global Health Compact that looks at 7 years with continued program of support by the G7. That ensures that we have committed long-term funding. Some of the challenges we have in the global health architecture is you see every framework, every so often, 3 years, is looking for replenishment. There's anxiety of program continuity because there is no long-term financing. That needs to be looked at under this G7 Global Health Compact that we asked for. The second point is inclusion, that we need equal partnerships of mutual accountability, mutual respect. We didn't see much of that, and we had recommended that there needs to be a thought around equal partnerships, including low-income countries, civil society presence and representation and consultation. We didn't see much of that. We need to see civil society at the center. And the final point is we need to see the knowledge economy created by the G7. The challenge we've had with the intellectual property waiver has been that we don't have a knowledge economy. Whereas we have public resources financing research and development, we do not have a framework for the transfer and the use of that intellectual property as a public good, despite the fact that we have public investments for research and development, especially as we saw in the vaccines. So these are the points I would like to reflect on, and I would hope that some of these points can be picked, especially the continuity of the global health agenda for the G7.
Thank you very much. It's good to hear, and hopefully we can all reflect on how we can be helpful in pushing these important points forward as part of the Indonesian G20 coming up. We come to our last round before we turn to the audience for questions, which is really looking ahead into this year and what is left as part of the German G7 presidency until the end of 2022, but also maybe looking ahead already to Japan and what are the key points that we want to explore synergies and make sure that the good deliverables that actually have been achieved or brought on the right path are being picked up on. If maybe I can start with Ms. Saito in your role and where you're sitting, because I think you'll be a great advisor for us, what you are expecting and what you're hoping for, especially, of course, in the field of gender equality. And we saw some of your requests already, but how hopeful are you with regards to the upcoming G7 presidency of Japan? And what will you be pressing for and hope to get support for?
Well, thank you very much. And this is, I believe, this is a question to my second hat I'm wearing now. And so my hat is a representative of Japanese civil society. In fact, my organization is coordinating a dialogue on global health between civil society and the Ministry of Foreign Affairs. And every 2 months, we have a dialogue. And certainly, I'm not in a position of talking about government, high and government focus next year. We're not sure. But I just want to let you know, 1 month ago, about Japanese government adopted new global health strategy for another 5 years. And that new strategy, we've been negotiating for the past 6 months. And there are some good key elements from the civil society. But anyway, so that objective of new strategy has two objectives. One is contributing to global health architecture, as you're discussing, to strengthen pandemic preparedness and responses. And the second point, as Angela mentioned, achieving UHC, universal health coverage, and which is resilient, equitable, and sustainable. And because from the civil society push, and they have cross-cutting issues in education, water sanitation, nutrition, population development, and gender equality and women's empowerment. And also SRHR is certainly involved in and included in the strategy, which is really hopeful for us. And then also the role of civil society is also included in the strategy. But actually, so what's missing from the strategy is the implementation part. So even though there is a role of civil society, we are not sure how they're going to proceed with so that elements. And certainly with the partnership, they have a target countries in the strategy, but we are not sure. Well, we hope their civil society organization from the partnership countries will be involved in that strategy. And my last comment is about, I want to just go back a little bit about the G7 communique and linking to Japanese G7 presidency. So certainly, Japanese actually focusing on UHC, universal health coverage, but what's missing from this year's G7 Germany is, so that the point SDG's core principle, no one left behind. Usually achieving UHC should be, achieving no one left behind, but that element is, I don't see that element in the communique. So hopefully next steps, we have more implementation plan to achieving UHC, which actually contributed to no one left behind.
Thank you very much, and certainly something that we've seen Japan pushing for a long time. So that'll be great if this was continued. I very much agree with that. Frau Rödiger-Vorwerk, the last word to you on, what are your hopes for the end of, towards the end of this year and the end of the German G7 presidency? We still have many months to go. So hopefully some goals, and how can we make sure that we have a good transition to the next presidency, and what should we bear in mind and conjointly push for in the last months?
Well, thank you for the question. First of all, I think what you just mentioned, the whole of government approach, that we have to be very clear from the different perspectives of the ministries that we have a common way to go. And this, we just heard the continuity in the G7. It should be the same. So that we aim for a sustainable political paving the way. This is what I would like to stress on. And Minister Schulze from my ministry, she's in close contact with the Japanese Vice Foreign Minister Suzuki regarding the handover of the focus of the topics for development cooperation, and Japanese priorities include a focus on Africa as well as a universal health coverage, as we just heard. So I think this is a good sign in terms of continuity, sustainability, really working on a structural change, transforming the global health system. I think this is our common goal. And regarding German government in the second half of 2022, we stay to our key priorities, which I mentioned earlier, and I just briefly reiterate them. So the first is really where there is a need, and I really say where there is a need, accelerating vaccination globally. This is in some areas still needed. The second is Germany is leading the way by contributing to the ACT-A last mile initiative. We are supporting 34 countries worldwide, mainly in Africa, to increase the vaccine uptake. And in total, Germany is providing 850 million euros. This is $920 million for the last mile effort as part of its funding to ACT-A, and to ensure G7, G20 synergies. We invite all G20 countries to join forces in this endeavor, building on the action plan endorsed by the G7 foreign ministers in May. So the third is in terms of supporting sustainable local and regional production capacities for vaccination. As I said earlier, Germany welcomes very much the initiative by the WHO and the Medicines Patent Pool, MPP, to set up the first mRNA technology transfer hub in South Africa. We allocated 3 million euros for this, and I just visited that hub last week, as they make big efforts to really run up the market. So this, I would say, are some of the main priorities, and not to forget, there's the replenishment of the global fund this year, so a big endeavor for all of us, and as well the polio initiative in the second half of the year. So it's really a year politically seen for global health, and I hope with the fifth we come to a more comprehensive, cooperative global health system, building all these puzzle parts into the picture, and then I would say this would be a good endeavor for the G7. Thank you.
Thank you very much. Famous last words. That's certainly a great, I think, hope and lookout. And absolutely, I couldn't agree more that this is a big year for global health with 2 big replenishments coming up. I thank the panel to start with for your great contributions. We'll have the opportunity to continue with the discussion now. And you were just mentioning polio. We actually have the director of the polio eradication at the WHO who happened to be in the audience, Aidan O'Leary. And it would be great to have your assessment, as we've just been talking about it. How can we leverage the learnings from the monitoring, from the polio program, from what we have learned over the years, potentially for the pandemic preparedness and response agenda, and how would that help us going forward?
So thank you very much for the opportunity, and for the very much listening to the discussions taking place over the last hour and a quarter. As the kind of director of polio, but also as the kind of chair of GPI, I think it's important to perhaps kind of frame the polio as a public health emergency of international concern. And what does this mean as kind of common elements? So we need to have an emergency response infrastructure in each of the countries in which we're operating. but also to recognize that we are most heavily deployed in those countries where we have the highest concentrations of zero dose or unimmunized or underimmunized children. And I use that to kind of set my comments on this. And what I will try and elaborate is a field operational perspective. So what was the impact of the pandemic? The pandemic meant that actually we were unable to conduct more than 60 campaigns targeting hundreds of millions of children over the course of 2020. So children who needed to be protected weren't protected. Our surveillance system was undermined because ultimately the challenge of moving samples, whether from cases of acute flaccid paralysis or environmental surveillance, were stuck in the logistic chains to laboratories, which meant that at times we were flying blind. We also had a further diminution of essential immunization. So coverage rates in 2020 leading into 21 diminished. Now, what does that mean for children? What it essentially means is that in terms of wild poliovirus, we recorded more than 140 cases of wild poliovirus in our 2 endemics in 2020. Even more troubling, we recorded a trebling of circulating vaccine-derived poliovirus cases, largely concentrated in those geographies where we have the highest concentrations of zero-dose children. So we've had a major setback. Now, what I think the program has also demonstrated is how it shifted in terms of supporting pandemic response. So essentially what we've had is the GPI infrastructure in 28 countries repurposed to support pandemic response and the introduction and delivery of COVID vaccines. We've seen the surveillance system, whether it's surveillance officers in the field, whether it's our laboratories, supporting the broader effort. Community mobilization, I think there was a reference to misinformation, disinformation and rumors. I think what we all recognize is that the key going forward is acceptance, confidence and trust. Tens of thousands of our polio community mobilizers were repurposed towards that end to address the concerns at source in the communities where it was needed the most. Our operations staff assisted with micro-planning, it assisted with the training of workers, it assisted with the, particularly the targeting of females. And why is this so important? We have learned the hard way in polio that in order to persuade mothers in particular, we need our women engaging with women to make sure that we can basically address concerns at source and, where necessary, to access inside households. We've also seen the issue of infrastructure and data systems. And everybody, I think, takes this a little for granted. But if I, for instance, take the example of Pakistan, Pakistan repurposed its emergency operations center in support of pandemic response. 1 country, 7 provinces, 180 districts, 8,500 union councils across the country sharing information on COVID to inform decision-making and response. This is not something that can be created overnight. It simply has to be repurposed to deal with the public health threat that was most prominent at that time. So where do we stand today as we move forward? I think we have seen really big progress since the last 6, 12, 18 months. We have an extraordinary epidemiological opportunity to finish the job once and for all. In Afghanistan and Pakistan, we have historically low records of wild poliovirus transmission. As Dr. Tedros has highlighted, we are tantalizingly close to finishing the job. In the case of circulating vaccine-derived polioviruses, what we have seen is a sharp reduction in the trends as we increasingly move into those areas where we have the highest prevalence of zero-dose children. But more must be done. It can't just be a question of cure. We need to actually address the issue of prevention through the strengthening of essential immunization. The zero-dose agenda is absolutely critical in that regard. They are interlinked. But I also think it's important to highlight that this isn't a question of just Africa and Asia. As we've seen in London, as we've seen in the Ukraine, as we've seen in Israel, where you have pockets of under-immunized children, the risk remains. So for as long as you have transmission anywhere, everywhere remains at risk. We need to proactively work to close those gaps. It's not easy, but it must be done. And then I think the last point that I would like to highlight is simply to commend the public health leadership role that has been demonstrated by Germany during the course of the last period. And I think, what we have basically seen is very proactive, hands-on support to really shift that agenda when it's a time that it's not so easy to do so. There are multiple demands on multiple fronts. And nonetheless, public health security, the public health agenda, is very much at the foremost. And we really thank Germany for taking the lead to co-host the pledging moment for the World Health Summit that will be taking place in October, and really to make sure that no child anywhere in the world will be at risk of this really horrendous infectious communicable disease. Thank you.
Thank you very much. Thank you very much. Certainly really important. Before I turn to the audience for some questions, there are a couple of really interesting ones that came through this tool. So I may combine one which centers around the fifth, just because it's come up quite a bit to you too. In the previous panel, it was said that decolonizing global health means that the donor doesn't have the solution, the partner country has. How will the implementing countries be part of the decision-making in the World Bank fifth? And the other question that I think is linked to that, if we think of the governance structure of the fifth and how it relates to the other actors in the global health architecture, should that not have been at least to an extent worked out before the fifth is actually agreed on and created and announced? So maybe I'll turn it to both of you for some thoughts on that.
So I'm starting. I tried to make it short. Shouldn't it have been agreed before? Perhaps. But on the other end, we have to use this political momentum. I just mentioned it before. When we look right now to the fiscal horizon, my personal opinion is that the window of opportunity is closing, and now it's important, and as it was already done on the 30th of June, that there was an agreement in the World Bank board that the fifth should be operationalized, and now it's our joint task to agree upon the things you were saying. So once again, timing is important here, and use the political momentum. That's my statement for this.
Yes, so a very, very in line answer from my side as well. So you have to use the political windows of opportunity, and I think we have done it. We don't want to write a thesis, but we want to bring something in an operational phase. The World Bank is a good place to manage a fund, and we have some lessons learned out of other processes like Act A or other World Bank funds. So we have to reiterate what we learned, and then we really have, over the summer, we have to bring a governance structure on the paper, we have to agree, and then we have to start. And I'm quite convinced that we will manage. And then it's up to how you operate a fund. It's not done with setting it up or with the governance structure, which of course must be inclusive, and representatives of the civil society have to be in it. But this is only a question of formalizing things. At the end, it's up to people to bring this to life and to really bring results out of it. And this is the most important part of it. And I really want to reiterate this. It's not only about structures, it's about how you manage these things. And it's not done with setting up the fund. That is only first part of the new global health structure. And I really appeal to all agencies and all civil society organizations. The aim must be to make a better, sustainable, and also less expensive system to reach more people, because value of money is the question behind this. And in terms of looking to the financial resources worldwide, we have to have an eye on how can we reach more people with the same amount of money.
So then, when it is inclusive, then understanding that there is the plan to include implementing country, of course, in the governance structure. That's fantastic. So turning to the audience, I don't know if I see any questions. Yes, please.
Many thanks. We have heard very much the bird-eyes perspective, relative far away from the ground, which is, of course, by nature, as you talk about G7 initiatives, etc. But I think it was very refreshing to hear from the polio eradication program what happens on the ground. And the same should be true also when we talk about epidemic preparedness. We have developed with WHO 3 departments an outbreak prediction tool for climate-sensitive diseases. This is a very practical thing, and this, I think, should be also done for the many other diseases. So in other words, the perspective from the bird eye is very good, very important, but also the development on the ground. Thank you very much.
Yeah. This was a statement. Anyone else on questions? Otherwise, I will have a look at very interesting slide questions here. Maybe Angela, one more for you. With regards to TRIPS. So it is, can you be a little bit more specific as a mechanism for pandemic preparedness on how you would like to see it, but also how do you feel from a political economy question? How do you feel that it actually, between the different G7 countries, which of course have all opposing views on the TRIPS, how do you see that can be overcome? And maybe also turning to Saito on the forthcoming Japanese presidency, do you see that there's going to be support for this? Or how do you see that landing in the current political landscape?
First of all, I have to admit that I'm not an expert on TRIPS, on the TRIPS weaver. But what I can imagine, what I'm thinking, following up the discussions and the public discussions, and for sure the negotiations in WTO, etc. So there are really different interests also in place. And I think what is quite important now is to have a look what is really, and here I'm with you, what is really needed. But needed with a perspective of health as a global common good. I think that it's quite, and that in another outbreak, it would be possible that that the TRIPS weaver makes possible a production of different health commodities in place at regional level and also at local level, which is coming in a very short time, really, to the people, and especially to the most vulnerable ones. Because for sure, what we have observed, for example, I have more conditions with East Africa for sure, but it really took a long time until the tests were in place, for example, or until really also then, afterwards, the vaccine doses were coming, that's true. But I think it's quite important really to establish a mechanism also with the countries like India, like Brazil, for example, to have a balance between the interests of pharmaceutical industries and research and development, for sure, but also to find the way how to strengthen more access, really more access to these kind of health commodities. And I could imagine that the G20, it's one of the instruments and the political instruments where the different interests could be discussed. And afterwards go back to the WTO to find perhaps another solution, because what has been found now, it's really disappointing, and it would not, it would not lead to any solution, I think so.
So you think an opportunity for the G20. With regards to the Japanese presidency, do you feel that there is any appetite to take it on, Ms. Saito? I'm not sure we can hear you.
Oh, sorry, I have a trouble turning on my microphone. Sorry about that. In terms of trips, Japan is kind of like taking its favorite position, neutral. So Japan is not opposing, or Japan is not like, in favor of any, waiving trips. So I don't know. In the next actually G7, and we like to hear. Well, we can hear some other favorite actual discussion about the trips, but maybe we can actually include that topics in the discussion of universal coverage. So, a pushing point from civil society is, so we are talking about the operationalization and on the ground. And so we need an intervention on the community level. So, and we are pushing those kind of implementation of universal coverage on the ground with civil society. That will, I think, open the path to, hopefully to trips and to other like a good health intervention on the ground.
We're almost at the end of our panel already. I'm just looking one more time to the audience, but I think we've exhausted probably your ideas for questions. So if there's no other one, then this leaves me to really thank you one more time for joining both virtually and here on the ground for this important discussion. It was, I think, a really broad one, an interesting one, but also one of great alignment, which is really good to see. I think there is acknowledgement that we have the challenge of fragmentation in the global health architecture, but also it was good to see how much enthusiasm is actually around the fifth specifically. It was good to see so much hope that can actually bring things together, and even if there is a road ahead to work, but that will help us to streamline and to also get the very important funding, as we've called it out many times, for both the Global Fund, for polio, for CEPI, for Gavi. We know these instruments work really well, and we know they're all lined up in order to come for replenishment. So it's great to hear. It was also great to hear that you've all called out the Act A as such a success, that of an example. We all know there have been, of course, shortcomings, but at the same time, I think it's right to state that it has been a great example of global coordination during extremely challenging times. We didn't talk about geopolitics, thankfully, but we did really call out the importance of sustainable funding, and I think that is a really important one to come. And also, Mr. Githinji, very much on the flexible funding, that we do need that to really be able to actually implement on the ground effectively. Of course, the issues of gender equality and access have been brought out many times, and I think we really need the voices of the gender equality experts, civil society. The point of inclusion, I think, has been made very clear, and even though we do know that it is a more complex and cumbersome way sometimes to come to decision, it certainly is the most sustainable one. So this leaves me to say that I do think it's been a fabulous process to have the W7, the T7, the civil society groups, the different engagement groups that certainly left the government with a big challenge to bring all of these different thoughts together, but it sounds like really the outcome is brought and also sustained by broad civil society and other experts buy-in, which is great to see. So that essentially leaves us with pushing for the main things that we agreed on, not to forget UHC or primary healthcare coverage under the next G7 and the G20, and make the most out of these upcoming summits on the one hand side and the last few months of the German presidency. So thank you all very much again for participating in the panel, and thank you very much to the Global Health House for hosting it.